All right. Well, welcome everyone. It's 10 o'clock my time, maybe noon where you are, or 1 o'clock. Welcome. Um, we're going to be here today for session 3 of our Resurgence of New World Screwworm in the Americas. I'm Dr. Paula Stigler-Granados from SDSU, and I'm going to go ahead and get us started. While people are still joining the session, I'm going to go ahead and kind of give a little bit of instructions of how the session will go. For those of you that are returning, thank you so much for coming back. For new people that have just joined us for the second session or third session, as a reminder, our first session was focused on medical doctors and healthcare providers. The second session that we had last week is mostly focused on community health workers and public health professionals. And this third session is a second part of the session from last week. So if you're joining us brand new, it's totally fine. We're going to do a recap of last week, and you'll still get a lot of great information today. If you're joining us for the second time, you're going to get the second half. And if you came to the first one, it's sort of a repeat of the very first session, the second half of the first session. But it's always good to have more information. Um, for our purposes today, we're going to be using the Q&A feature, which you can find at the bottom of your screen, or however your screen is set up. It's a question mark. It says Q&A. If you have questions about the topic, like a question about what was just presented, please put that there. We will also use the chat feature for you all to introduce yourselves. Please feel free to put your name and where you're from in the chat. And also, if you have questions about technical questions about the session or anything like that, if you need any support, we have lots of people here to help. So I'm going to introduce our presenter, but also let you know that we have multiple people from the CDC on the Q&A on standby to help support answering your questions, and then several of us monitoring the chat as well. So go ahead and next slide. So this is our accreditation statement. We are giving out CEUs for community health workers today, and for physicians, you can claim Category 2 credits for this as well. Next slide. And so this is our agenda. Right now, we're doing a welcome. I'll do introduction and announcements like I'm doing right now. And then we will have our presenter give a presentation. We'll also have questions and answers at the end, but we'll also have time in the middle. We're going to stop after kind of halfway through the presentation to check in, to do some Q&A. And again, like I said, you can also actively, as you're thinking about them, put your Q&A questions or their questions into the Q&A, and we will be actively answering them during the session. Everybody should be able to see those questions once we've responded to them. And so you can take a look at those and follow along that as well. Let me just see. I'm just going to check if all of our panels can just double check that you have your mute on. I think Sue Montgomery, you might need to mute. Okay. And then we'll have some closing remarks at the end. Next slide. Okay. So I'll go ahead and start off. For those of you that were here last week, you've already met Dr. Chansey, but I'm going to go ahead and reintroduce her for everybody that's new this week. So we're honored to have Dr. Rebecca Chansey, a medical officer at the CDC, where she focuses on parasitic diseases and emerging zoonotic threats. She's been the co-author of the Pediatric Review article on congenital Chagas disease, as well as over 45 different journal articles and book chapters on numerous parasitic diseases. As a pediatrician, she has a strong interest in the clinical management and public health epidemiology of parasitic infections in children. And she's been an invited speaker at national and international conferences and is very passionate about educating others on parasitic diseases, as you'll hear her talk in this session. She's currently recognized for her work in raising awareness on the resurgence of New World Screwworm and its risk to human and animal health. And so we're really honored to have her as a leading expert on this in the country, talking about this directly with you all. And if you're wondering, for those of you that normally join our Chagas disease sessions, this is we're utilizing the same network that we normally talk about Chagas disease, because this again is an emerging parasitic disease that is very important to us right now. So we need to keep all of this on our radar along with Chagas disease as well. Next slide. And again, I'm Paula Stigler-Granados, Associate Professor at San Diego State University. I lead our Environmental Health Division here in our School of Public Health. I have about a decade of expertise on Chagas disease with our longstanding CDC cooperative agreement focused on education and community engagement, which is also supporting this work today. I'm actually really sad that tomorrow is our last day of having this award for the last 10 years. But it's been really great doing this work. I currently also do a lot of work with our Department of Defense, military populations, and we've been leading echo sessions on Chagas disease for the past 8 years. I have a lot of interest in those social determinants of health, environmental issues, and health issues along the US-Mexico border, which this New World Screwworm is impacting our border region right now, or soon it could be, so that's why we're here to talk about it. Next slide. All right, so at the end, we're going to show this again, but we do have those continuing education credits available. We'll also have you filling out an evaluation. We'll put a link to this in the chat as well, but if you have an opportunity to grab a snap of this with your phone, if you're on a computer, or again, stay tuned, we'll put it in the chat with a link so that you can fill this out at the end of the session. If you filled one out last week, we'll ask you to fill out another one. So please do so with this new link that we're attaching. And with that, just a couple of reminders while Dr. Chansey pulls up her slides. We've got Sue Montgomery and Mark Fox from the CDC who will be in the Q&A answering responses. We're also monitoring the chat. So if you just joined us, as a reminder, we're not going to do raising hands because we have too many participants right now. We have about over 200 participants. Thank you all for being here. The Q&A feature will be used to ask questions about the topic, and the chat you can use to introduce yourself, tell us who you are, where you're from, and also if you have technical questions or you need some IT support or you have questions related to the slides that aren't content related, please put that in the chat, and we'll also have a couple of activities where we'll be using the chat feature as well. And so with that, I would like to turn it over to our amazing presenter today, Dr. Chansey. I'll let you take it away.
Great, thank you so much. So this is the second session for community health workers. It's the third session overall in this ECHO series, but I'm grateful that everyone came back, or for those of you who are new, that you've decided to join us today. We're going to focus on human and animal infestations, treatment, and reporting. The links to the recordings from the previous two sessions are available on YouTube, and you can go back and listen to those if you would like to.
Dr. Chansey, really quickly, I forgot. We were going to also just tell everybody how to do the translation feature if you need Spanish. So, Angela, I think you were going to go ahead and read a statement about how to access that for us, please. I'm sorry, I forgot.
Yes, of course, no worries. So hi everyone. If you need interpretation services for today's webinar, please select the Show Captions button at the bottom of the screen, turn on translation, and select your desired language. Hola a todos, si necesitan servicios de interpretación para la sesión de hoy, seleccione el botón de subtítulos en su pantalla, active la traducción y seleccione el idioma deseado. Thank you.
Thank you so much. Okay, go ahead.
Okay, thank you very much. I have no financial relationships to disclose, and this is the accreditation statement. And so we want to welcome you back and remind you that a quick review of things we talked about last week. The damage caused by New World Screwworm maggots, which are the larvae of the New World Screwworm fly, can be very severe and even kill wildlife, livestock, pets, and people. Once the New World Screwworm fly is introduced into an area and becomes established in that area, it's very difficult and expensive to control and eradicate it again. Currently, New World Screwworm is spreading north from Central America into southern Mexico in areas where it was previously eradicated. The key to keeping New World screwworm out of the United States is staying aware and knowing what to do about a suspected maggot infestation in an animal or a person. Last week, we talked about where New World screwworm had previously been in Mexico and Central America before eradication, and where it was now re-emerging as the fly is moving northward. This map is from USDA from last week, I believe. They are releasing sterile flies in the area shaded in green, which is the area, the northernmost point of the outbreak. And they've identified by boxes the total number of cases that are in each region of Mexico. These represent animal cases, but we know that there are also human cases in the region as well. What I want to point out is the red dot right here in Nuevo León. That's the newest case that they detected last week. It was an 8-month-old cow that was transported from the southern area of Mexico north to Nuevo León, about 70 miles from the US-Mexico border. And so the goal is to make sure that the fly is not and does not become established in Nuevo León. And that's what USDA is currently doing right now. So a quick poll question, true or false? New World screwworm affects warm-blooded animals, mostly livestock, but the maggots can also infest humans. Okay, thank you very much. So almost everyone got this correct. The answer is true. New World screwworm can affect all warm-blooded animals, including humans. So we're going to talk about that today. Some of the risk factors for New World screwworm infestations in people include having an open wound, especially if that wound is already foul-smelling, ulcerated, or infected with bacteria. If you have some skin conditions that already are causing breaks in the skin, such as eczema or psoriasis, that is also a risk factor for having the fly lay the eggs there. Patients with compromised immune systems or diabetes are at higher risk of infestation, and people who are not able to protect themselves from flies or insect bites, regardless of why. If they're not able to protect themselves, then the fly has free range to lay their eggs there. And then obviously people who are elderly or incapacitated are also at higher risk. Some of the other risk factors we want to consider are people who are sleeping outdoors where the fly may be, including those working around infested livestock where the fly may be. But you could be spending time outdoors in other areas doing other things where the flies are circulating and still be at risk for infestation. There's a myriad of different activities that this could cover, but some things might be working outside, gardening, hiking, anything that you're outside exposed to the fly. There is a risk of New World screwworm in travelers who are leaving an area without the fly and traveling to a country where there is the fly. And New World screwworm could then be imported back to the country that's currently free of New World screwworm when travelers return from these countries, whether it's an outbreak country in Central America and Mexico or an endemic country. And identifying these travelers who have infestations is really important to make sure that the traveler is treated quickly and that no larvae are lost. If larvae are not disposed of correctly, they could develop into the flies and continue the life cycle and then multiply in new places, which is what we're trying to avoid. You may have heard that in August of this year, CDC confirmed a travel-associated case of New World screwworm in a person who was returning to Maryland from El Salvador, which is an outbreak-associated country. The patient was treated and has recovered, and all of the known larvae were accounted for. And this is a copy of the press release that was disseminated by Maryland, USDA, and HHS. We talked about this last time, and I said I would include these slides, Regarding travel-associated cases, you can look on the CDC website at all of the countries in Central America where the outbreak is currently ongoing, and you can find an alert box on each of the countries. This is a representation from Belize, and it says that the cases of New World Screwworm myiasis have been reported in these countries where it had previously been eliminated, and it gives some advice for what travelers to these destinations should do, and links to information about New World Screwworm. We've also updated the country pages where New World Screwworm is endemic in South America and the Caribbean. And this is a representative page from Colombia that shows where you can find the information in a different location on these endemic country pages. This information about New World Screwworm is found under the section about avoiding bug bites so that people can know what to do if they travel to these countries. So going back to New World Screwworm infestations in people, the screwworm can cause an infestation of any wound, like we said, and the wound can be as small as a tick bite. It can be very imperceptible, and the fly can still find it and lay the eggs. In addition to wounds, the fly can lay the eggs on any mucous membrane or body opening that might include ears, eyes, nose, mouth, even places like the vagina or the rectum if they're exposed to the fly. Some of the symptoms that you might see of New World Screwworm in humans include pain, sensation of movement, a very foul smell, and bloody discharge. There is often extensive tissue invasion and destruction, depending on how many larvae are present and how long the larvae have been in the area. And then you will often see the larvae and the maggots in and around the open sores, moving in and out and about. Oftentimes, there's secondary bacterial infections, and this may cause the wound to become red or have pus expressed. And you can also, as a result of the bacterial infection, have fever or chills or a severe illness if the bacteria get into the system. Death can sometimes occur, both in animals and in humans, due to the bacterial infection and due to tissue destruction. And you can see there's two pictures here on this slide. One patient had an ulcer on the face with redness and skin erosion and pus and was found to have the larva in the wound. And then the second picture is a huge ulcer filled with maggots in a patient who had lymphoma. So what might New World Screwworm infestation look like in people? Sometimes it's subtle, and I'll show you some pictures on the next slide where you may not think about New World Screwworm immediately. But sometimes it can be quite obvious, again, if there's lots of tissue destruction and lots of larvae present. It depends on where on the body the infestation is located, how long the infestation has been ongoing, and that's why it's really important to encourage the person to seek medical care immediately and not wait for symptoms to worsen. And this is a picture of 150 larvae removed from a patient who had infestation in his nose after returning from travel. The first picture on the left, picture that's labeled A, you can see the patient's ear, and then the arrow is pointing to a hole behind the ear where there's a wound. And this open cavity behind the ear is filled with larvae and maggots. You can't see it very well in the picture, but that's what the medical provider found when they were examining the patient. The middle picture, again, looks like a hole in the leg where there had been a wound. And this person had been in Costa Rica and then returned to Canada. And they found lots of larvae inside of that wound when they went to debride the wound and do wound care. The third picture on the far right is an area of a patient's scalp where there was some creamy wound exudate, and there were lots of larvae moving in and out of this wound on the skin surface, and that person sought care. So these are three examples of wounds that were infested with larvae in a human. So how is New World Screwworm infestation diagnosed in people? Unlike other kinds of maggots, the New World Screwworm maggots only eat living flesh. There are other types of maggots that may infest wounds that are not New World Screwworm, and so it's important for physicians and healthcare providers to be aware of that as well. And that's why identification of the larva is key to knowing what actually is infesting the person. All maggots should be removed, whether it's New World screwworm maggots or other maggots, and submitted for identification. How is New World screwworm infestation treated in people? Anyone with a suspected New World screwworm infestation should seek care from their healthcare provider immediately. Don't wait for it to get worse. Go right away to see the physician. And all of the maggots must be removed. And removing the maggots may require surgery depending on how deep they are, where on the body they are, how many there are. Removal and proper disposal of the maggots by a healthcare provider will help prevent the spread of New World screwworm in the area. The patient or their family may notice the maggots that are dropping out of the patient before they get to the healthcare provider. And it's really important that if you see this, you make sure the maggots are collected and or killed, because again, we're trying to avoid the life cycle continuing on to a new fly. And I'll talk about that in just a moment. This is a picture of the life cycle that I want to remind you of. We start here on the left with the adult fly, and these adult flies find a mucous membrane or find an egg or find a wound, and they lay their eggs in that mucous membrane or wound. They can lay 300 to 400 eggs in a very short period of time, just a few minutes, and those eggs then hatch and become larvae or maggots, and those maggots then stay within the person for up to 7 days as they eat the tissue and destroy the tissue. And what we're trying to identify is the wound with the maggots and then kill the maggots so that we can stop the life cycle at this point where the maggots become pupae when they fall out of the wound. So by requesting your help and educating the physicians and the public and the community health workers, we're hoping that identifying any person with a larva in the wound, we can kill and remove all of the larvae and make sure they don't become pupae. So treatment of a New World screwworm infested wound is important both to prevent reinfestation with other flies and also allow the wound to heal. The most important thing, as I've said, is to remove every single maggot. This may require checking on the patient the following day in order to make sure that no additional maggots were left after the first attempt at extraction. Making sure that you provide pain management, because as I said, this is a very painful thing for the patient to experience. And then if there is a bacterial infection, to give antibiotics. How can people protect themselves from New World screwworm? You can keep the skin wounds clean and covered, can limit exposed skin by wearing loose-fitting long-sleeve shirts and long pants, or hats or socks. By using insect repellent, ideally containing DEET, you can hopefully prevent bites that may then be a location for the fly to lay the eggs. You can also treat clothing and gear with 0.5% permethrin, and then sleeping indoors or in rooms with screens will decrease your exposure to the fly. So how are we keeping New World screwworm out of the United States? By early detection and reporting. That means faster response time and fewer infested people. And we're requesting that if you hear or see anything that you think might be New World screwworm in a person, please report it right away to your local or state public health department. Remember, I said that any maggots need to be removed from the wound, and you can submit all of those, or the state health department can submit all of those to our lab for identification. And please encourage a patient with suspected New World screwworm to seek medical care immediately and not wait for the wound to get worse. So let's take a quiz. Sometimes screwworms can infest people. What are the symptoms of screwworm in people? The options are skin wounds that get bigger or won't heal, feeling movement inside a wound, a foul smell, or all of the above. Great. The correct answer is all of the above, and you all did very well. So now we're going to spend a little bit of time talking about New World screwworm infestations in animals.
Dr. Chansey,
Yes.
I wanted to see if we could take just a moment for a short check-in to see if people have questions before we move on to the animal section.
Sure.
I see somebody does have their hand raised, but if you wouldn't mind, if you could please put your question in the Q&A. And we do have people actively answering questions. We had a couple of good questions so far in the Q&A that have been answered. So just one of the questions was, is this the same thing as a botfly or similar but different species? Mark Fox was able to respond to that. I know we talked about this in the last session, but would you mind just sort of mentioning the difference between like a botfly and the New World screwworm fly?
Yeah, I'll let Mark answer if he's willing.
Sure, let me get in front of the camera. No, yes, no.
Sure.
Oh, there we go. That's me. They are different species. And it's a good question because that's going to be a differential sort of consideration because they occur in the same parts of the world. The botfly, human botfly, is present in South and Central America and Southern Mexico. So if you have someone who with travel history and exposure history in that part of the world, you would need to bear in mind that both of these could be possibilities. Thankfully, the clinical presentation is pretty different, and the morphological or what they look like when you pull the maggot out of the person are quite different. The botfly is much larger, and typically there's only one of them in the wound, and it's causes a different type of myiasis called furuncular myiasis, which I believe that term refers to the fact that it's like a boil under the skin. The skin is mostly unbroken except for a tiny opening where the fly breathes, and then there's a single maggot growing underneath the skin. Whereas the New World screwworm makes an expanding wound and will often have many maggots inside. So I hope that helps. Yes, and we have lots of resources on our website through those links that were shared, where if you're curious, you can see the pictures of the different ones.
Thanks, Mark. And then also another great question about DEET. And I think you responded to that as well. I don't know if you want to just elaborate a little bit on that so that everybody can kind of hear what you were saying in the question.
Sure, yes, there aren't any targeted repellents that are specific to the New World screwworm, but any sort of general wide spectrum insect repellent is if it's on the EPA list as safe for you to use, then then you should consider using it, or you should consider recommending it to anyone who asks, because the flies are susceptible to broad spectrum insect repellents. So yeah, DEET is one of the best repellents across the board. So that's definitely on the list of the ones that we would recommend.
Great, thanks. And I'll go ahead and just read this question out loud because I think it's really good that somebody's asking why it's even called screwworm if we know if it's not actually a worm, but it's a fly maggot. Does anybody know? Do any of you know how it got that name?
It dates back to when maybe people weren't as particular. I think everyone always knew that they were fly maggots, but I think that the term worm in common use, they weren't very strict about only calling worms worms. The screw aspect, we do know why, because they both sort of screw into a wound. So the pointy end, if you look at them, they have a pointy end and a flat end. Pointy end is where the mouth is, and that end points down and sort of drills into the surface of the healthy tissue, with the flat end remaining exposed. So that's just like a screw. They also sort of look like screws because they have rings of tiny spines on their body that look like the threads of a screw. But yeah, they're not worms. They are maggots. So that's a correct observation.
And then the scientific name, Cochleomia hominivorax, came about. Hominivorax means man-eater. And so in the 1800s, there was an island where a lot of prisoners died, and people noticed fly maggots on them. And they realized that the maggots were contributing to the destruction of tissue in those patients, and called it hominivorax, man-eater.
Thanks. That was some really good information. A great question too. I'm wondering if we have any other questions. Does the screwworm have a natural predator? That's a good question. Do you guys know?
Not a very good one, unfortunately. I mean, I'm sure that like the adult flies would be vulnerable to things that eat flies, so bats and birds and anything like that. They tend to be active in the day and hide out sort of on foliage at night. But they don't have like a specialist predator that we're aware of that would be effective at limiting their population. But not that I'm aware of.
And I
It's a
think,
good question, though. I'll look into it.
yeah, and I think last week we talked about what happens if an animal eats the fly, and we discussed that it would not continue its life cycle. Basically, it didn't survive in the gut or anything like that. Usually, I think that was what we talked about.
Yeah,
Um,
and there's also weather limitations to the fly and larva as well. So the extremes of temperature in the cold and then like dryness don't allow the fly to propagate the larva.
Also, have we seen any wounds that won't heal, despite being removed and with antibiotics?
I think that gets to the patient's clinical status. So if the patient is immunocompromised or has uncontrolled diabetes or has some other reason that, wound healing would be challenged, like malnutrition. But once you remove the active destruction by the larva and the maggots, and then it becomes a regular case of wound care. And if you work in clinical medicine, you probably have seen lots of different people who have wounds. Depends on the location. Some wounds like bed sores or diabetic ulcers are harder to treat just because of the patient's underlying condition. But removing the larva is the first and necessary step to helping heal the wound.
That's great. And then, like following directly along that line, somebody asked if they could be suctioned out rather than just picked out one by one. Do you know?
So, uh, if you are brave, I encourage you to watch the link to the news report that's a couple slides ago where I mentioned that one of the people traveled to the Dominican Republic and came back to the US and had an infestation in his nose. Apparently, the ENT doctor who saw them attempted to suction out the larva from his sinus cavities, and the larvae were getting stuck in the suction. So they ended up having to manually extract all of them. So I think it would depend on the setup that you have at the hospital, what kind of suction machine, how big it is. But it sounds like the larvae in that situation were pretty tenacious and trying to remain in place and didn't want to be suctioned out.
Okay, that was a very, sorry, that was a very descriptive response. Thank you for that. And then maybe I'll answer one more and then we'll, or two more, and then we'll jump over back into the animals and we'll continue to answer your questions in the Q&A. But um, someone asked if the screwworm infestations are more problematic than other myiasis. Like, does it cause additional infection or a larger infestation than, say, a non-screwworm myiasis?
So the point that we want to emphasize with the difference between screwworm myiasis and other myiasis by other larvae is that screwworm myiasis, the larvae eat healthy tissue. So they will destroy living healthy tissue, whereas the other types of facultative myiasis are typically consuming dead tissue, and so there's no additional destruction that happens in those cases. And so we if you see a patient with myiasis, you may have a suspicion of what kind based on where the myiasis is located and based on the patient's clinical condition, but you can't know unless you remove the larva and have someone morphologically examine the larva. Only then can you know which kind of larva it is. And so regardless of who the patient is or where the larvae are located, removing all of them is the key, and then having identification. But the big distinction between New World screwworm and other types of myiasis is the destruction of healthy tissue.
Great, thank you. And I think sort of one last question is, do they release any type of toxins or so there's another question too, kind of along those lines, if they secrete any specific enzymes or other factors that facilitate feeding on live tissue. So toxins or enzymes that support that.
Mark,
Um,
yeah, go ahead.
yeah, no, they're waste products. I mean, if they're eating, they're also pooping. So, you know, and if they're inside of an open wound, that's not necessarily great. But uh, as far as I am aware, they don't do any like external digestion where they would spit out something that, you know, chemically digests tissue so that they can eat it. It's mechanical chomping. Like they use their little mouth hooks and they just chew through the tissue. So it's very destructive and painful from all reports. I did also have one anecdote that I found a case report pertinent to the prior question about the different types of myiasis. There's something that is used called maggot therapy, which for people who have wounds that are in delicate areas, it takes advantage of the fact that most of the other types of myiasis flies don't eat healthy tissue. They only eat dying or dead tissue. And so sterile lab-raised maggots would be introduced into a wound to take advantage of the fact that they will delicately only eat the tissue that you want to clear away. And I found a case report where a doctor thought that they would achieve that by just leaving maggots in a wound that they had found, and it turned out they were New World screwworm, and not one of the nice ones that only eats the dead tissue. And so they were very shocked that the wound kept expanding and the patient got worse and worse. So just to reiterate that there's a reason why we encourage early proper diagnosis by submitting to an expert.
Okay, great. Thank you. And I think with that, we're gonna go ahead and move on to the next section, and we'll have Sue and Mark still answering questions in the Q&A as we're moving through this, so we have enough time to get through all of our material today.
Okay, great. Thank you so much. So as I said, let's talk about screwworm infestation in animals. So any warm-blooded animal is at risk for New World screwworm infestations, but ones that we see more often are livestock like cattle, horses, sheep. A lot of dogs currently in Central America and South America are being infested. Cats are at risk. Deer, we talked last time about an infestation in key deer in Florida in 2017. Pigs or feral hogs, other wildlife, other birds, all of these animals are at risk of New World screwworm infestations. In animals, the illnesses can be more severe depending on the animal's age and the location of the infestation. And animals, just like humans, can also become very sick from a bacterial infection as a result of the New World screwworm infestation. Treating with medications can be successful when the infestation is detected early, and if left untreated, infestations are usually fatal in 7 to 14 days. And almost all newborn animals with an infested umbilicus will die. These are some pictures of New World screwworm in animals. You can see that these wounds often have bloody discharge. They often have a foul odor. Lots of maggots can be seen in the wound, up to hundreds. And there may only be a small wound, but you can have lots of maggots deep underneath the skin. And animals can present as depressed, stop eating, separate from the herd or self-isolate, or shaking of their head. Treatment of suspected New World screwworm in livestock or domestic animals can be done by the veterinarian, and you want to seek veterinary assistance as soon as possible. And animals should not be moved except to take to the vet and keep them in a safe, contained space. Wear any gloves and collect any maggot-like objects that may fall on the ground and save them in alcohol to give to your vet. And do not discard any maggots in the trash or throw on the ground. Preventing New World screwworm in animals, you want to make sure to protect your livestock and other animals by being on the lookout for any infestations of New World screwworm. You can do this by checking your animals regularly for wounds and providing wound care for these animals. So that means ear tags, navel, after birth, if there's any scratches, any small wound is important to provide care for. You want to minimize procedures in animals that may cause wounds, such as dehorning or ear tagging, and report all suspected infestations of New World screwworms in animals to your veterinarian. So from USDA, if you suspect New World screwworm in your animal, contact your veterinarian, get treatment for your animal as soon as possible. Do not move your animal except to take them to the vet. Keep your animal in a safe, contained space. Spray down potentially infested areas with a pesticide or insect spray. Collect any maggot-like specimens and save in rubbing alcohol, and wear gloves to protect yourself. And you can find this advice from USDA on this link here. If you hear of or see anything that you think could be New World screwworm, report it right away to your local veterinarian, the state animal health official, or a USDA veterinarian. And I've put some of the links here to find those resources. So let's take another quiz. If you were here last week, you remember us talking about our friend Maria. She's back and she's taking her dog to the vet. And her dog does have New World screwworm in its wound. Maria is worried about her family. What are things that her family can do to protect themselves? The options are keep skin wounds clean and covered, protect your skin from flies by wearing loose-fitting long-sleeve shirts and long hats and socks, use insect repellents, and sleep indoors or in rooms with screens. Okay, great. So the correct answer is all of the above. All of these can help protect yourself from a New World screwworm infestation. So now let's talk a little bit about maggot recovery and handling. So if you suspect a screwworm infestation in a person or in an animal, these are the most important first steps. Contact your healthcare provider for a person or your veterinarian for an animal. Do not try to remove the maggots yourself, and encourage the person to seek medical care immediately. Keep the animal in a contained space and do not move them except to take them to the vet. Save any maggot-like specimens that may fall out of a person's or an animal's wound and that you see on the ground, and remember to use gloves if you're picking them up. Report any suspicious cases to the local or state public health department for a person, or to your local veterinarian, state animal health official, or a USDA for an animal. So how to save New World screwworm maggots for testing? Do not remove any maggots from the wound. Only pick up maggots that may have fallen off or you notice on the ground. Wear gloves and use forceps to pick up the maggots. Place the maggots in a leak-proof container with 70% or greater isopropyl alcohol, which is rubbing alcohol. The volume of rubbing alcohol should fully cover the maggots, and this will kill the maggots and preserve them for identification. You can see the pictures on the slide, the forceps and the jar, and there's no rubbing alcohol initially. And then you can see in the second picture, the rubbing alcohol fully covers all of the maggots. Do not discard live maggots in the trash or throw them on the ground. And then take the maggots in this leak-proof container with you to the doctor or to the veterinarian. So let's practice. Remember Maria that we just talked about? Her dog was diagnosed with New World screwworm infestation, and now her husband has a painful wound that seems to be getting bigger and has a strange odor. What do you tell Maria, or what do you tell the husband? You can put your comments in the chat.
All right, I'm going to jump in here real quick. This is sort of a conversation and how do we communicate with people? So this could either be, what do you think Maria should say to her husband? Or what would you say if you're a community health worker or a public health professional working with Maria? What do you think would be the most appropriate? Seek professional help. Don't try to take the larvae out alone. That was one response. Please go to your doctor right away. I think that's a really good response. He needs to see his healthcare provider. Hold on, the chats are coming in so fast I can barely keep up. Here we go. They need to save the maggots they find, place in a jar with rubbing alcohol, right? Firstly, don't kiss the dog in the photo. Seek professional help immediately, and don't touch anything. Do you have comments about that, Dr. Chansey, about touching things or sort of the communicableness of this?
Right. So the way that the larva is transmitted, again, that life cycle that I mentioned, the fly lays the eggs on the wound or the mucous membrane, and then after a period of time, the eggs become larvae, and then the larvae eventually become pupae, which then eventually become flies. So this is not like other diseases where it can spread from person to person or by touching. It requires the life cycle to be carried out.
Gotcha. I think the comments about kissing the dog was a general hygiene comment too, by the way.
Sure. Yes.
Maybe
Agreed.
don't kiss your dog. Um, I like this, give the vet a heads up, like a call, and then take the pet to the veterinarian. Don't move your pet anywhere but to the vet. And what about the human? Same thing, right? The husband. What if, and I'll just pose this question. So what if you know your dog has been diagnosed and now your husband has this wound? What could you tell them to communicate to their healthcare provider? What sort of language would you give? Say you're a community health worker and you're speaking with Maria. What kind of language do you think that you would give to her to provide support to advocate for her husband's care? Let's see.
I think that's a good question because although we're trying to educate providers to make sure they are aware of this, oftentimes, as Mark mentioned, people may think about the other kinds of myiasis first before the New World Screwer myiasis, especially since it hasn't been in the US since the 1960s. And, not many people have seen a case of a traveler. And so I think having language for the husband to make sure he can advocate for himself to the provider is a really important question.
Yeah, so I had someone say contact your healthcare provider and be sure to include the animal incident and travel history as part of the case history. I think that's really important. I think it's just like we deal with Chagas disease. A lot of times providers have not heard of this yet. And so if you have a link, even like to this information that has been shared here, that could be also shared with healthcare providers, I never think it's a bad idea to take what you can to our healthcare providers to give them that information so that they have everything that they need.
Right. You guys are now the ones with the education and the information and the ability to advocate. And so, pulling up the CDC webpage, pulling up the information about the larva, any of those things could be useful to share with a healthcare provider.
Especially if the dog was already tested as positive, that's another indication that it could have been spread in the same household. Um, let's see, somebody said, Maria, this wound seems similar to the one we saw earlier with the pup. Why don't we take Mr. whoever M to get his wound checked to confirm that it isn't New World Screwworm? I like that. I think they were erring on the side of caution with that communication to confirm that it isn't, instead of saying that it is. I really appreciate that conversation, that way of communicating, kind of de-escalating, right? Not causing panic. Wife needs to call the doctor, check the wound for any signs of infection, cover it with a towel or dressing, and clean the room as soon as possible, wearing gloves, good hand hygiene, and also call the vet. Inform your healthcare provider of the New World Screwworm diagnosis and the family pet. It's absolutely true, as we've said. So a lot of the responses exactly that, telling the healthcare provider about the dog.
And so again, just to reiterate, the husband did not get the infestation from the dog. The presence of the infestation in the dog and potentially in the human indicates that there's flies in the area, and multiple flies in the area can infest anyone. and by both of them being in the same location, that indicates that there's likely flies in that area.
Exactly. And I thought this was interesting. Like, please don't wait for maggots to seek care. Inform your provider of your dog's recent diagnosis so that they can provide appropriate care. What do you think about that? So preemptively going.
I think that there are I think if there's an infestation in the dog, then hopefully the state animal health officials are already aware, and they will likely have actions that are being taken in the area where you are. If the human doesn't have any wounds or cuts or painful infestations or bloody discharge or signs of an infestation themselves, then focusing on the prevention and the covering in your skin and covering your wounds and making sure to follow the advice of the state officials and the USDA officials, I think is probably the next best step. The healthcare provider likely won't be able to do anything if there's not an active infestation in the person.
Great. I think also, covering the wound also, I mean, that's important in any kind of wound care, right? So just generalized good wound care is important, but
Right. Sorry, I was talking about if the patient did not have a wound. If the
oh,
patient
go
has a
ahead.
wound, then yes, definitely cover it and clean it. And they should already theoretically be in under care of a physician if they have a wound that's has a strange odor and is getting bigger.
And maybe we could mention too that we do not have this in the US right now. So
Correct.
this wouldn't have just appeared in a dog unless this family had traveled somewhere, potentially already having been exposed. In this scenario, though, this is sort of a made up scenario, like if it were present here in the US, or if maybe this family lives in a place where they have it right now, etc. I think that's sort of that, also being clear about that.
Yeah,
Um,
it's not present in the US right now. What we are trying to identify is with the fly being present 70 miles south of the border, it's very possible that one, flies don't really care about borders, so it could fly over the border, just itself, or it could infest a wildlife and the wildlife crosses the border. And so we're trying to encourage anyone and everyone who potentially sees a wound that may be New World screwworm, myiasis, to contact their state health department and their state animal health officials so that if there is the first case that happens along the border, we're able to identify it. It may have come across from wildlife. It may have just fly may have flown itself. So it's possible, if you're in those higher risk areas, that the dog is the first case that happens in that area. But it's not here right now.
correct. And so far, the only cases we've had in the US have been travel related cases, correct?
That is correct. Yes.
Somebody said here the community health worker should look for an HAN. I don't know what HAN is, and see
A
if
HAN, a
huh?
health advisory notice, is that what they were referring to?
Oh, maybe. Then it says, and see if this can escalate to state epidemiologists given concern for endemic infestation.
Yes. So again, if there's any concern at all, notify the appropriate authorities in the state, whether it's the animal authorities or the human authorities.
Okay. And again, maybe reiterating, say the humans living in this household don't have any open wounds or signs of infection. How important would it be for them to go ahead and notify their healthcare provider of this incident, or should it be something that they wait until they have evidence of?
In working with the states want to know if there's any New World screwworm at all, whether it's an animal or a human, and they're working very closely between the human and the animal counterparts. And so each occasion may occur differently, but if you have an infestation in an animal and you notify your vet and the vet notifies the state animal health official, that state animal health official should notify the state public health personnel, who will then, coordinate together. So you can notify the physician if you want, or you can also notify the state epidemiologist, but hopefully those lines of communication are occurring from, collaboration between the animal and the human side.
And is it required right now for a veterinarian to report it to the local health department or state health department?
Yes, USDA is requesting, again, we're working closely on a federal level between USDA and CDC, and on the state levels as well. They are working closely together. And USDA has all sorts of information on their webpage for veterinarians and other people who engage with animal health. And so they're requesting that the state officials, the state animal officials are notified if there's any cases.
Great. Just a couple of general questions too in the chat, just to clarify. I know we talked about it, but it says, is the adult fly more active during the day or night? I know you mentioned it is more active during the day, but does it have a peak season of activity? That might be a Mark question.
Yeah, it depends on the weather, but yeah, Mark, if you want to comment on that.
It does. It depends on the environmental conditions. So weather or seasonality. So in the closer to the tropics where you don't have seasonality, they all year round is pretty similar, like summer, winter, etc. If it does reach our area, we would expect to see higher activity and higher cases in the summer and the warmer months generally. And if it's in an area that actually fully freezes in the winter, then that will kill all the flies locally, and they would have to then reinvade or be reimported from an area where they are able to live through the winter. And that was the pattern that existed in the U.S. before it was eradicated back in the 30s, 40s, and 50s.
What about, thank you. And what about extreme heat and dryness versus humidity?
They like it warm. They can tolerate it dry, but don't prefer it. So, I mean, it can be a little bit subtle. Like if there's tons of host cows in an area and a fly comes in, on a train or something, you could get an outbreak and an infestation, even if it's more dry than they would normally prefer. But for the fly to just sort of naturally distribute by migrating, and attacking wild animals and things, it's going to prefer areas that are a bit more humid and with tree cover, because again, in the night they like to hide in foliage.
Okay, that's good to know. I'm thinking about Texas and its geography and what it can be like out there. Sometimes hot and humid and sometimes dry. So, depends on where you are. In Texas, as you know, lots of microclimates there, but mostly hot most of the time.
Yeah.
Um,
We're
except when
doing,
it's
oh,
not,
sorry, go ahead.
that except when it's not, when it gets really cold, but
Right.
like 3 weeks out of the year.
I was going to say that, yeah, both our team and the people working on this with the other agencies with the USDA and others are looking a lot at the historical data. Essentially, we know where it used to occur in the US, and so that is predictive to some extent of the places that might be vulnerable to have it again.
Great.
So yeah, we do have information on that, but it's many decades old.
Thank you. And then maybe one more question, was general, is how long can the maggot live outside of a wound before it turns into a fly?
So once it has to have the host time, there has to be those different life cycle stages. And so after the eggs are laid in the host and then it becomes larva, it can live up to 7 days within the host, eating and feeding, and then it falls out. And then it falls into the ground for a period of up to like 54 days before it can emerge as a adult fly. If it when they fall out of the person, out of the host, the animal, whichever it is, they become the pupae if they are far enough along in the life cycle within the host in order to be able to pupate. But they won't live, let's say the animal dies. If the larvae are not able to become pupae after the animal dies, then the larva also will die. Is that right, Mark? Any comments or additions?
Yes, this question has come up a bunch of times. So I did look into this a little deeper. Essentially, the fly has to take in a certain amount of food in order to be able to complete development. And this has come up where people wonder, like, oh, if the animal dies and is no longer living tissue for the fly to eat, will it drop off? Will it continue to eat the animal even though the animal's dead? And the answer is no, it won't continue to eat the animal once it's dead. It will drop off. If it is in the late second larval stage, so there's the egg, first stage, second stage, third stage, and then the pupa. So if it has reached the third stage and drops off, it can become a pupa and then become a fly. If it is late enough in the second stage where it's taken in a lot of calories by eating a lot of the host's flesh, there is a chance that it could then on the ground become a third stage and a pupa without eating any more meat, if that makes sense. So if it's an egg or if it's a first stage larva and it drops off the host, or if the host dies, then it can't proceed. But if it's late second stage or third stage, it can.
Great, thank you. And I think for now, that's really good conversations. I'm just going to remind people if you have any questions about the content, go ahead and keep putting them in the Q&A. We're going to go ahead and keep going a little bit further. I think we're going to be sharing some resources and then have time for more discussion after that as well. If you want to go ahead and resume, Dr. Chansey.
Yeah, thanks. And that is basically it. I wanted to share some of the websites that we've developed. This is a website about New World Screwer myiasis for the general public. It's in both English and Spanish. And then there's a website for healthcare providers and laboratorians for how to identify New World Screwworm. We also have a website that was just published specifically on the outbreak, and I didn't make a slide for it, but you can, just Google CDC New World Screwworm outbreak and you'll find that page. And then the key things to remember are, as we've said many times, the screwworm maggots feed on living flesh and can infest any warm-blooded animal and people. And the faster you can make the diagnosis means the faster we can treat the patient to prevent serious complications and even death. And then the faster we can identify that it's actually New World Screwworm and report a suspected infestation of New World Screwworm is critical. We want to make sure that there's enough response time for fly control and that we can alert people to the risk for human and animal infestations in the area. And as I said during the section on collection, if a maggot falls out of a wound before a person gets to the doctor, or you notice it, in the house, or an animal gets to the vet, make sure that the maggots are appropriately handled, which means using gloves and tweezers and putting the maggots in a leak-proof container with 70% or greater isopropyl alcohol, which is rubbing alcohol, to fully submerge the larva. So you guys can make a difference, and we want you to know what to look for, and we want you to know how to report it. But you, as community health workers, are a huge part of this equation and the solution to this problem. So here are some additional tools to help you for downloading and printing. And, it includes both web pages about New World Screwer myiasis, some information from USDA about animal infestations, and then some information about repellents. And this is where you can find us at CDC. We have a New World Screwworm response email address. And then if there's any healthcare providers on the line who have questions about patients, we can be reached at the parasites@cdc.gov email address. That's all I have, Paula.
Great, thank you so much. And so with that, I think we're putting some links in the chat, and again, also we're gonna have a document that has all of the links from the presentations, and then we'll also share a PDF where you can click on a lot of the links that have been presented today. I know this was a lot of information. And so we open now to questions about what we talked about. I think I saw a question in the Q&A, and I know Mark was also answering it, but I kind of wanted to just like to sort of clarify it and with the whole audience in case anybody didn't see it. So the flies themselves need living flesh in order to reproduce. And so there was a question about sewers having a variety of living things like rats. Is this a place that could easily breed and establish themselves if they were reintroduced? And I know, Mark, you responded to this question, but maybe you want to just talk a little bit more about what that would look like, because I think these flies don't reproduce in the normal ways that we were normally accustomed to with like normal flies, right?
I'm sorry, I was thinking about a different question in the chat. Can you
That's
tell it
okay.
to me one more time?
Yeah, the question about like sewer systems having lots of things like rats, etc. Like if this creates a place where flies could easily breed and establish themselves if they were reintroduced. And I was just kind of mentioning about how the flies need the living flesh in order to reproduce themselves. And so it's not quite the same as a regular like housefly, for example. And I wonder if you could just describe that a little bit more like you did in the Q&A.
Sure. Yeah. It is a good question, and I don't know that it is possible, I guess, that sewers could be a place where flies could breed. My instinct though, because we know they like to, for the New World screwworm, after it finishes feeding on the host, which in the sewer there certainly are hosts if there's rats down there, potential hosts anyway. But they would then need to drop off into the soil, and if the sewer is what I imagine a sewer to be like, wet and damp and prone to decay and mildew and all of that stuff, it may not be a hospitable place for the fly larva to drop off and successfully become a pupa and an adult. So and if you think about like the other flies that are associated with garbage and dirty areas like that, I mean, they do sort of have a similar thing where they drop off after they're done feeding and they pupate just, on the ground or wherever they are. But they may be more tolerant of high moisture and high, fungus or all of that. So I don't have a firm answer, and it is a good question. But yeah, the fly does have to pupate in the soil or in the and so if the sewer environment is not sufficiently like topsoil, it may actually kill the flies.
Great. That's a good response. It's kind of a tricky question, and I think it's a good one because this is sort of a new concept since, like you said, we haven't had this fly, here in the US in decades, right? And so I think we're still sort of trying to understand it a little bit more. We've gotten some questions about how it's different. And I know that how the New World screwworm fly looks different from like a regular house fly. And we can put a link in the chat to last week's session where you can see the PDF or the recording. And I think Dr. Chansey, you did a good job we had a little quiz about being able to determine what is a house fly versus, or different types of fly versus the New World screwworm fly. And I don't know if you have that handy and wanted to show that, or I could just direct people to look up last week's presentation. Do you have a preference?
I can try to find it real quick.
Might be good because there were several people that may not have been able to come last week. So it's always a good reminder. And it's also a good reminder. I keep forgetting what they look like too.
Yeah, give me a second.
Problem. Also, let me just see. Mark also put a good description of it, saying it looks a lot like a common green bottle fly that we see all over the US. So she's gonna hopefully share a couple of images so you can see the differences.
Okay, yes, I'm ready to share my screen. It's being slow to come up though. Okay, here we go. Okay, can you see?
Not yet. There we go. It's trying to share. Okay, yes, now we can see.
Okay, perfect. So the one on the left is the New World screwworm fly, and these other two on the B and C are not the New World screwworm fly, but you can see how similar they look. And if we go to the next slide, the New World screwworm fly is blue or blue-green with 3 darker, nearly black patches running down the back. And then this particular fly in section B is called the flesh fly. It's gray and black with bristles, and it's very common and widespread and associated with decaying flesh of dead animals. And then this one, C, is called the green bottle fly. It lacks the 3 stripes of New World screwworm, but it's in the same family as New World screwworm. It's very common and widespread and associated with rotting material like food trash. they probably come in contact with both B and C on a regular basis and just, didn't know.
Great, thank you. I think that's really helpful. We definitely see a lot of flies, and sometimes I actually don't really look at them that closely. I don't know if people do. Like now I will, but before,
I will. Yeah.
yeah, just sort of a fly is a fly is a fly, you know. It's fun to watch my cat try to catch them. But now since I notice differences. All right, so do we have any other questions? Maybe just reminding people that we are recording this session. We will have a link to this. We've put it in the chat, a link to last week and the week before's presentations, if you want to watch them again on YouTube and share them with your colleagues. But any other questions? Please fill out the evaluation. We're trying to get out the credits to you as soon as possible. Within the next couple of weeks, we will be sending them by email. I know we've had our great partners at AHAC that have actually been sending them out a lot faster than I had expected. So, but I don't want to promise that in case there's a lot going on this week. Let me see.
Paula, I'm seeing a couple other questions. There's one that says, can maggots feed or attack on intact skin, or will they only feed on non-intact or open wounds? And I think that's an important distinction as well. There are other types of flies, like Mark mentioned, the bot fly that does attack intact wounds and mucous membranes.
Great, thank you. I had somebody ask if we could give the answers to the evaluation questions. I don't want to give them out right now because some people may not have taken the evaluation yet. But what we could do is at the end of this session, we could send out a thank you email to everyone who attended and then provide the response, the correct answers. I just don't want to give it away now. If that's, I thought about giving them and then I realized that might give them away. And the reason why we're asking these questions at the registration and at the final evaluation was to see if the information was provided that you were able to understand it or absorb it, or we gave the right information out to you. So if you don't get them correct, it's okay. We'll send out the correct responses. Maybe I can have him do that when we send out the certificates. And then also just a final thank you once we see people have taken the evaluation. So please be sure to fill out that evaluation. Check the session chat here. We can post it in there one more time. Actually, can we show the Cato, can we show the slide with the QR code in case people would also prefer that? There we go. All right. We still have time for a few more questions. If we have any, this has been a really good session. I also want to say thank you to Mark and Sue for doing a lot of the responses, and also to our Echo team. We have Cato and Angela with us today who've been supporting us, and then Belle Flores from Area Health Education Center's AHAC team who's providing our CME CEUs for this. So thank you. And my counterpart at Texas State, Dr. Zhu, is here as well. So just a shout out to say thank you. Somebody's asking about future sessions. Do we have any plans for, or does the CDC have any plans for future sessions such as this? Or are we going to just be using the recordings as much as possible?
Definitely using the recordings as much as possible. I know New Mexico is hosting an echo session in October that we've been invited to participate in. I'm not sure who receives that invitation, if it's only New Mexico or if it's elsewhere, but that's the next one that I'm aware of coming up.
Great. And then hopefully you can share this on your website as well, so we can just make sure everybody has access to this, which again, we will post this third session on our YouTube channel for our echo sessions. Again, this is usually through our Chagas disease network, but we'll have that available, and I believe we've put it in the chat a few times.
So one of the questions is why gloves are necessary and why use tweezers. That's just in general appropriate hygiene for any kind of, I don't want to say it's a sterile procedure. Obviously, if you're dealing with a wound, it should be somewhat of a clean procedure. But these larvae, if they've been inside a wound, could have bacteria on them, which is how you get that secondary bacterial infection. And so it's just good, appropriate hand hygiene practices to prevent you from getting any bacteria transmitted. They have the spines. I don't know, Mark, how prickly are they actually if you pick them up by yourself without any gloves on?
Not at all. No, there's no reason not to pick them up with your fingers other than that you might find it gross, or as Rebecca said, if they're in the wound, you don't want to put your fingers into the wound. But the maggots are harmless. And the spines are microscopic. You wouldn't be able to feel them.
But they do, as we mentioned last time, they are very fast and mobile. And so if you do identify them outside of the wound, they might be scurrying across the floor. So just be aware.
Yeah, they will fight to stay in the wound, but once they're out of the wound, they will probably try to squiggle away.
Thank you. I am keeping my camera off because you do not want to see the faces I'm making right now. So sorry. I'm really appreciative of this topic. It's just it's a hard one. These are some really great questions. I know several of you might be making the same faces ever having to dealt with any kind of maggot. Really, they're just gross. But these in particular. Maybe kind of going back to, I just want to bring this up again about communicating with community members because again, this is on the news. It's making its way around, especially in our border communities. And so, making sure you have access to the handouts that have been provided by the CDC with great information. Again, they're in English and in Spanish. Just kind of being sure to speak with people, with calmness and just like we do with, the sensitivities that we have to have. Of course, there's, stigma associated with this disease, just like with other diseases of parasitic infections. And so, I don't know if anybody has any questions about how to address sort of the sensitivities about that, but um, I think communicating prevention and communication with their providers or if you're a community health worker, being that conduit between the person, the patient, and their providers is really important. So, bug spray, also talking about recommending that as a preventative measure. You want to talk a little bit more about prevention in terms of like clothing, bug spray, say for example, that maybe they live near a farm that knows that there's been a New World screwworm outbreak. Do you have any recommendations for prevention without having noticed it at home?
Yeah, so I think one of the things that I was surprised by when we were looking at all the cases that are occurring in Central America and Mexico is the number of cases that are occurring on the scalp. And that's a place that, we talk about wearing long sleeve shirts and long sleeve pants, but making sure that people are covering their heads as well. Again, this fly can get in anywhere. We've seen cases in the ears and in the eyes and in the nose, and so obviously you can't cover everything, but to the extent possible, and if you're working outside, you want sun protection anyway. So covering your arms and your legs and wearing a hat, using the bug spray, and just being vigilant about what's around. Obviously, if you are a worker, hopefully you have the capacity to swat flies away. But this is where we get concerned about people who may be incapacitated or elderly or have some other comorbidities where they don't have as much ability to swat the flies away and prevent the fly from landing on them.
And maybe you could talk just a little bit more about the timing. I know we talked about it a little bit, but maybe sort of reiterate how long does it take for a person to become infected? How big or small does the wound have to be? Just to kind of give people an idea of sort of how this could manifest in a shorter time period than we might be thinking.
Sure. So we say that the wound can be as small as a tick bite. So you think about that, it's barely visible to the naked eye. So any mosquito bite, any tick bite, any ant bite, it really just has to be a break in the skin. So like with eczema, psoriasis, some of these other skin conditions, they can be subtle breaks, but any non-intact skin is at risk for the fly laying the eggs. And again, Mark can comment, but some of the hypotheses that we've been discussing, there was a case, of a person who had just a couple of larvae in their wound, and we're presuming that potentially that person was able to swat the fly away, but the fly laid enough eggs that there were a couple larvae that emerged, within a very short period of time. It only takes a minute or two for the fly to lay hundreds of eggs. Mark, any other comments?
Yeah, that's exactly right. But there are definitely old case reports where people describe a fly just very briefly, almost brushing against them, and then later they found a larva that was, in their wound. So based on the commonly reported, like it takes, I forget the numbers exactly, but like if it takes 3 minutes to lay 400 eggs, then they're laying eggs at a rate of about 1 per second. So if the fly is only on you for a second or two, it might only lay 1 or 2 eggs, but that's certainly sufficient to cause a problematic, painful infestation, as we saw with that one case. I also did just read more about there had been an outbreak in Libya in North Africa in the late 1980s and early 1990s, and in that they found that a lot of the cases, the human cases in Libya, were in children and in the scalp, and their theory was that the children tended to have head lice, and that was a risk factor. So that's not in our guidance currently. It's something I just learned about, within the past few days. But it does speak to the same thing of like eczema, psoriasis. It's just these very, very superficial, sort of small breaks in the skin can be enough.
That's important, I think, to note, making sure obviously kids get lice sometimes and you can't really control that very easily, but good to think about that with our pediatric populations, checking the kids for lice. And then what about dandruff? Kids oftentimes, at least I know from having a 10-year-old, they don't always get all the soap out, and so they tend to scratch their heads a lot. So I'm imagining that getting dandruff from, just difficult hair, you know what I'm
Yeah,
talking
in
about.
any break in the skin. So anytime you're scratching, especially in an area that's sensitive like that, where you might have some skin breakage, is definitely a risk factor.
Yeah,
And the hygiene component, we've seen, not that dandruff in your child is not hygienic, but we've seen a lot of cases in Central America and Mexico, where hygiene plays a key role in whether or not someone gets infested. And so making sure that the person in general has good hygiene.
Great. And I think also, especially in like our southern states, mosquitoes, right? Mosquitoes tend to be almost unavoidable, like mosquito bites. I am in public health. I work in vectors, and my daughter to this day must have 10 bites on her legs that don't heal as quickly as I would like. So despite my insistence on wearing bug spray, kids can be a bit, hard to handle, but I think making sure just like general mosquito prevention is important. Keeping that bug spray around. Again, I keep one in the car, I keep one on the front porch, I keep one in the back porch just to remind myself if we go outside to use bug spray. It's kind of important. So that might just be something else to be helpful. Question in the chat about rodents being at risk. They're a mammal, so I assume they are, right? Rodent, right? They're warm-blooded.
yes. Yeah, again, a lot of the work that was done back when this was endemic in the US in the 1930s and 40s, especially in Texas, there was a pretty big research push to look at what animals were involved, because you can control the cattle all you want and you can inspect them and treat them and everything, but if wild animals are maintaining the fly, then you'll never get rid of them. Which is why the sterile male release was so important, because that affects both wild and domestic animals. But they did find that like rabbits, possums, armadillos, raccoons, you name it. If it's warm-blooded, it'll support the fly.
Thanks. Also, a good point brought up by Dr. Wozniak in the chat was about thorny brush, especially in Texas. And so definitely, keeping an eye out for even small scratches, like when you're out and hiking or just in general being outdoors, long pants, long shirt, sleeves, keeping your head protected, things like that.
Yeah, we've definitely seen multiple case reports of active people who've been out, they happened to fall while hiking, or they, were biking and they fell. And again, all it takes is a small break in the skin if the fly is around, which the fly is not here right now, but we are educating you so that when or if you see something suspicious, you're able to report it.
Thanks. There's a really good question too, because this is pretty common practice, is hanging a clear plastic bag inside your door to prevent flies from coming into your house. I've never known it to work, but I do it anyway sometimes because it's just one of those things. When I lived in San Antonio, everybody did it. Sometimes we put a penny in the bottom of the bag as well. It's just I'm pretty sure it's a myth that this works, but
Yeah, I've never heard that. What is the theory or the mechanism behind that?
I've heard lots of theories. People have said that they see themselves and get, scared, or that it's just one of those things that works, but lots and lots of people do it. So I don't think that it's necessarily a practice that I would rely on, honestly, but I don't know. Mark, have you heard of this practice?
Yes, it is widespread in the South. We saw it in New Orleans all the time. I, yeah,
I don't know
I need to
why.
look into. I feel like there's been some research into whether it works or the extent to which it works. The practical answer is it's not going to hurt anything, and if it keeps a couple of the flies away or distracts them, I mean, there's no harm in it. And if you're already doing it to drive away or to distract other flies from going near you, then knock yourself out. But I definitely wouldn't put it up and expect yourself to be fully protected. I would still recommend doing all of the other things that we talk about.
It's interesting because I know I have chickens, and so there's this theory in the chicken world about hanging vanilla tree car fresheners in your coops to help ward off some of the flies, because flies are a big problem around chicken coops. And I have been guilty of hanging 20 of them myself, and they did not work. So what about fly traps? I do use fly traps outdoors, for my chickens. The ones where it's the stinky stuff you put in there and then the flies go in and they can't come out. Is this something that would work? Are they attracted to this fleshy, dead? I don't know that they would because it's like a dead smell, right?
Yeah, someone asked that exact question in the Q&A. Uh, and the best answer I could come up with was I don't know that they would be totally unattracted, but they have a very strong affinity for the smells from active wounds. There is a very powerful bait that the USDA has and used in the past and is trying to get approved to be able to use again, called swarm lure, which mimics the chemicals from a wound. So I think that, yeah, again, I don't think it would hurt anything, and it might somewhat attract some of the flies if they're around, but I don't think it'd be protective or something that you could rely on.
Great. These are lots of great questions. Thank you all for asking them and being present. I hope that we've been able to answer most of your questions. I know we're coming right up on about a minute left. So if there's any sort of last minute questions, I think we're still going to be answering a few in the chat right now. So I have one question about watching it under your coworker. She did it last week. Can I still do the evaluation? Just put your name and email in the chat, and then also you can send us an email. I can put my email information also in the chat right now. So if anybody does have any questions about their CEUs or how they logged on or anything like that, you can also, if you don't get your CEUs, please feel free to reach out. It's pstiglergranados@sdsu.edu in the chat. If you want to take a screen grab of that or grab that email, be happy to answer questions also after this session and help link you to what you might need. Do we have any more slides to show at the end? I don't know if we updated our final slide or not, so I don't know if we want to show it. Here we go. Another question is the CEUs. Fill out the evaluation. There's a link in the chat for the evaluation. If you could click on that, go ahead and fill that out. We'll have your information there as well. And again, we've recorded the sessions. We have put a link in the chat to our current website where we have the recordings from the last 2 weeks. This will be the same place. It says Chagas disease, but again, this was a special emerging topic under our Chagas disease education platform. So you'll be able to review those recordings. Also, I believe CDC will have those recordings. I don't know if they're going up on your website or not, but you could probably provide a link if you're able to. These certificates for CMEs or CEUs will be sent out within the next few weeks. And I think that is everything. I'd like to thank everyone, especially Dr. Chansey, for being here and presenting this information. We had almost more than 200 people sign up today to attend, so thank you so much. We also really appreciate you being here. If you do have questions, you have lots of contact information for us, but also even if you go to the PDFs of the presentations from the last 2 weeks, you can click on those links that we've got provided in those. So you can actively go get those right now. And then we'll also be in communication to send out the PDF to everyone who attended, along with a document that has the links in it as well. So with that, I think I'm going to go ahead and wrap up our session. I think we've got Mark answering one last question in the chat, but otherwise you're fine. Mark, go ahead.
It's the question is about sending in maggots that are collected. I think we had some links on one of Rebecca's slides earlier. And certainly
Yeah, and I
the
just
links.
tried to
Yeah.
answer it in the chat as well. But if it's an
Okay.
animal case, please coordinate with your state public health department or your state animal officials. But the human cases, the state public health department can submit to us at CDC, and the animal cases, the state animal health official can submit to the NVSL lab through USDA.
Perfect. Yeah. Thank you, Rebecca. Yeah. And you can always reach out to us too if you're not sure how to proceed. And we can go over it again on an individual basis.
Great, thank you. Would you also state that the local or state health department is going to be the first point of contact generally for most
Yes.
people? Okay. It's like that.
Yes, they want to know for any suspicious cases, especially along the border states. But everyone that we've talked to, there are many states who are preparing for New World Screwworm. They're educating their staff. They're trying to, become aware, and so they would like to know of any suspicious cases in their states.
Including travel-related cases as well.
Yes, correct. Anything.
As I was just seeing somebody from like New Jersey. So if there's travel-related cases, you've got access to some really good information here as well. Okay. Well, we are a little bit past time, so thanks for sticking in with us. For those of you that joined us and are still here, thank you again so much for your participation. Feel free to reach out if you have questions, fill out the evaluations, and thank you again for coming.